Good afternoon. My name is Inez Ponce, and I am the director here at the UCLA Center for Health Policy Research. At UCLA, we pay respect to the Gabrielino Tongva peoples as the traditional land caretakers of the Los Angeles Basin and South Channel Islands. Thank you for joining us for today's online seminar, the California Health Interview Survey 2019 data release. As the nation's largest state-level health survey, the California Health Interview Survey provides actionable data on the health of and healthcare for California residents and is used by legislators, policymakers, local health departments, state agencies, community organizations, foundations, researchers, and students, and more to create population insights and make informed decisions and compelling arguments to ultimately improve public health. Chiz began in 2001, and since then it's been recognized for its value as a high-quality data source on population health and health equity and its contributions to survey science. The 2019 edition of the survey, which includes information from over 22,000 adults and over 3,000 adolescents and young children, covers a broad range of topics about the health of Californians, including medical conditions, access to health care, mental health, and health behaviors. So today we'll walk through timely data on voter participation in advance of the national election, as well as some of our brand new questions on how physical and environmental factors affect health, social media and mental health, sex without consent, immigrant access to healthcare in light of key policies, such as the new public charge rules, veterans and suicide, and much more. Next slide, please. As always, today's slides are available on our website, or they can be requested from our communications department at the email address shown on your screen. Please note that we have some members of the Chiz team monitoring and responding to online questions. We will reserve the last 15 minutes of the seminar for the Q&A, and we do encourage you to ask questions throughout the presentation using the Q&A function in Zoom. So now let's begin today's discussion. We are releasing the Chiz 2019 data on schedule, and the 2020 Chiz data collection continued without disruption. Our UCLA CHPR staff and data collection partner quickly made technical innovations and operational adjustments at the outset of the pandemic and the switch to working from home for UCLA CHPR staff. The 2019 Chiz also reflects a redesign that was successfully implemented to improve data collection and to assure a robust sample. I'll go more in detail on the redesign and the subsequent slides. Next slide. For those of you just tuning in, learning about Chiz, here's some quick facts. We're the largest state health survey in the United States. We cover health behaviors, health access, and utilization, of course, but we also collect comprehensive information on race, ethnicity, on sexual orientation and gender identity, and a host of measures on socioeconomic factors such as employment, education, and the neighborhood environment that shape the opportunities or barriers for an individual in achieving good health. Our sample is large enough to generate estimates for the state and larger counties and county groups. These estimates are used in research, policy, and program planning, and we thank the community supporters and collaborators from the public and private sectors, from research institutions, advocacy groups, and community organizations. Chiz is representative because it is probability-based. After a household is screened for eligibility and household members are rostered, a randomly sampled adult, child, and adolescent is selected to participate in the survey. And to minimize coverage bias, that is that the survey reaches millions of Californians where English is not their primary language. In addition to English, the survey is conducted in Spanish, Chinese, Cantonese and Mandarin dialects, Korean, Vietnamese, and Tagalog. Given the growing difficulties experienced by telephone surveys back in 2017, Chiz considered a possible redesign for the 2019-2020 cycle. We established a working group back in 2017 to help consult on the development of new data collection methodology for Chiz. And in 2018, we conducted 2 field experiments with the proposed methods, including 3 county feasibility tests and statewide pilot. Following our analysis of these experiments, we finalized a design for 2019 and went into the field in 2019. Under the new design, we transitioned our sampling frame from random digit dial of landline and cell phones to an address-based sample. We contacted selected households through a 2-phase design. First, we sent 3 mailings to a selected address requesting the adult with the next birthday to complete the survey online. And each mailing also provided a telephone number to call so that the selected adult could complete the survey over the phone with a trained interviewer if that was what they preferred. In phase 2, trained interviewers called addresses matched to a telephone number who had not yet responded to complete the survey over the phone. Since Chiz is done in several languages, we targeted multilingual mailings to likely Spanish-speaking and Asian households based on big data machine learning methods to model household characteristics. So here we see the 2019 sample yield by race, ethnicity, and by the age group of the respondent. For reference, we achieved about the same yield for adults as we did in the previous data collection year of 2018. But I'm so pleased and so thrilled that with this redesign that we about doubled our adolescent and child samples from the previous year. Because we understand the importance of trending Chiz data over time, we conducted a thorough analysis over a variety of variables to see where problematic shifts in the data may have occurred. So we focused on trying to disentangle if changes observed were due to actual changes in the population over time, or changes in the sample composition due to the changes that we made in the sampling frame and how we conducted the survey, or possibly measurement changes due to the switch from the telephone to now primarily web data collections. About 90% now is web data collection. So based on the evaluations, we feel assured that the data users will be able to trend most Chiz variables across the redesign. And some variables may see unanticipated shifts, and thus we encourage everyone to interpret trends with caution. But specific examples and discussion on how to potentially interpret these trends are detailed in a Chiz 2019-2020 redesign report paper, which is available now on the Chiz methodology webpage. And thank you, Brian Wells, for that. So I will now turn to Todd Hughes, the director of the California Health Interview Survey. Todd?
Thank you, Ninez. Good afternoon, everyone. In addition to the redesigned survey methods we implemented in 2019, the Chiz questionnaire content evolves each cycle to address emerging topics important to our stakeholders and funders and to the California population at large. The What's New document posted at the link here highlights all of the changes in our design as well as our survey topics. This slide presents the list of new topics for the 2019 survey as contained in the What's New document from the previous slide. You can see the new set of topics is quite diverse, including health-related behaviors, social determinants of health, and healthcare services. The list in the What's New document also details how to access the data for these topics through public use files, the Ask Chiz data exploration tool, or through our Data Access Center, which I'll discuss a little further in today's presentation. I know you're anxious to learn about what the 2019 Chiz data have to say, so let's take a look. New to the Chiz in 2019 was a pair of questions asking respondents to score on a scale from 1 to 10 the importance of 2 sets of factors on a person's health. First, they scored the importance of genetics and medical care to a person's health. And next, they scored the importance of individual or environmental factors, such as behaviors or access to healthy food or recreation. We then compared their scores to both questions and found that a little more than half of respondents scored them equally important. About 30% scored individual choices or environmental factors higher, while approximately 15% scored genetics and medical care as more important. When examining this more closely by age group, we found that respondents age 18 to 44 were even more likely than those age 45 and older to score individual choices or environmental factors higher, 34.4% versus 29.4% respectively. And those differences were statistically significant. Also new to the Chiz in 2019 was a series of questions asked of adults age 65 and older about how often they felt lonely, hardly ever, sometimes, or often lonely. Notice that these data reflect conditions in 2019 prior to the COVID-19 pandemic. We identified significant differences by gender, as well as by marital status. Specifically, women were slightly more likely overall to report feeling sometimes or often lonely versus men. Greater differences were observed for marital status, with married older adults reporting feeling hardly ever lonely, almost 20 percentage points higher than their counterparts that were separated, divorced, widowed, or other. Those identifying as single or never married reported similar rates to those separated, divorced, or widowed, of whom 27.8% reported feeling sometimes lonely, and 6.5% reported feeling often lonely. But what is the impact of this loneliness on the well-being and mental health of these older adults? This slide examines the prevalence of older respondents who described experiencing serious psychological distress in the past 12 months and compares it to their responses to the questions about loneliness, and we found a striking connection. First, looking at those older adults, 65 plus, who reported having serious psychological distress in the past year, 20.7% reported being hardly ever lonely, 49% sometimes lonely, and 30.3% were often lonely. However, when looking at prevalence of serious psychological distress among older adults reporting feeling hardly ever lonely, only 1.2% of them experienced serious psychological distress in the past year, compared to 11.3% of those who feel sometimes lonely, and a striking 42.2% of those who report feeling often lonely. These data from Chiz show a connection between loneliness and mental health for older adults that certainly deserves further exploration. Sexual violence was a new topic added to the Chiz in 2019, and we present on this slide rates of adults reporting having ever had sex without consent since age 18, with rates shown here by sex, by gender identity, by race, and by sexual orientation. Bisexual adults had the highest rate, with 1 in 4 bisexual adults ever having sex without consent as an adult. Other LGBT populations also had disproportionately high rates of non-consensual sex, including transgender or gender non-conforming adults at 17.8%, and gay, lesbian, or homosexual adults at 15.8%. Female adults reported having sex without consent at a rate that is 10 percentage points higher than males. Next, we look at the mental health impacts of non-consensual sex. According to the 2019 Chiz, more than 1/3 of those who have had non-consensual sex as an adult have reported having serious psychological distress in the past year, or have ever seriously thought of committing suicide. Among those who report ever having had sex without consent as an adult, 33.5% report serious psychological distress in the past year, compared to 12% of those who never had sex without consent as an adult. That difference is even slightly larger when looking at suicide ideation. 38.2% of those who had non-consensual sex as an adult report ever seriously thinking about committing suicide, versus 12.9% of those that have not had non-consensual sex as an adult. Another new topic for the 2019 Chiz was computer and social media use. On this slide, we compare the frequency of social media use with mental health, again looking at reports of serious psychological distress in the past 12 months. We asked Chiz respondents, quote, on a typical day, how often do you use a computer or mobile device for social media? Almost constantly, many times a day, a few times a day, or less than a few times a day, end quote. Among those adults who answered that they use social media less than a few times per day, only 8.6%, or fewer than 1 in 10, reported serious psychological distress in the past year. However, among adults that reported using social media, quote, almost constantly, nearly 3 in 10, or 27.9%, experienced serious psychological distress in the past year. This difference is statistically significant and shows a correlation between high social media usage and poor mental health outcomes in adults. For our final look at mental health in this preview of the 2019 CHIS, we look at suicide ideation among veterans. We report here a significantly higher rate of adults who have ever seriously considered suicide among veterans versus those who did not serve. Also, we see that those differences are more pronounced among female veterans, especially those aged 25 to 44, of whom 41.7% report ever seriously considering committing suicide, compared to 16.4% of females their age who did not serve in the military. However, significantly higher rates of suicide ideation among veterans versus non-veterans were seen in both males and females for age 25 to 64. Asking adults if they have provided care in the past year to a family member or friend who has a serious or chronic illness or disability was also new to the 2019 survey. We learned that 1 in 4 adults provide such assistance. The most frequently reported recipient was the caregiver's mother or mother-in-law at 29%, followed in order of frequency by a neighbor or non-relative, father or father-in-law, other relative, grandparent, sibling or sibling-in-law, wife, and husband. Also of note, 3 in 5 of those reporting to serve as a caregiver were female, with 2 in 5 being male. We asked those adults who reported providing help the amount of time that they spent on caregiving, and 1 in 5 of them reported spending at least 21 hours per week, or more hours than a half-time job. Another 24.3% of caregivers report providing assistance for 8 to 20 hours each week, with approximately 28% providing 3 to 7 hours or 2 hours or less, respectively. And then finally, I'd like to share some data on the impact of the current administration's expansion of public charge rules, and whether we found evidence that it may prevent qualified immigrants from applying for needed aid out of fear that it would threaten their green card status. We found in 2019 that 16.1% of adults born outside the US reported that they ever avoided applying for non-cash government benefits, such as Medi-Cal, food stamps, or housing subsidies, for fear that it would impact their green card status. We also learned from adults born outside the US that 28.4% were asked to provide their social security number, proof of citizenship, or legal status when trying to obtain medical services. And 15.5% were similarly asked for their social security number or proof of citizenship or legal status when enrolling themselves or a child in school. So with these results in mind, and given next week's election, I'd like to turn our attention to the subject of voter behavior as measured in the 2019 CHIS. And I'd like to introduce my colleague, Dr. Susan Babby, Senior Research Scientist and Co-Director of the Chronic Disease Program at our center, who will share some highlights from the fact sheet she authored on this subject that was released today. Sue?
Thank you, Todd, and thanks to all of you for being here this afternoon. I'd also like to acknowledge the co-authors of the fact sheet on which this presentation is based, Joelle Wallstein-May and Shana Charles. So the election is next Tuesday, and millions of Californians have already cast their ballots. But who in California is less likely to vote? It depends in part on the type of election. 10.5 million eligible voters in California reported that they sometimes or never vote in elections. This includes 2.8 million who said they never vote, and 7.7 million who said they sometimes vote. This number is even higher when it comes to local elections. Nearly 13.5 million potential voters in California reported rarely voting in local elections, including 6 million who said they never vote in local elections, and 7.4 million who said they sometimes vote in these elections. Who was least who was less likely to vote varied by race and ethnicity. Among potential voters, the percentage who reported they sometimes or never vote was higher among people of color. In presidential elections, 39% of Asian, 34% of Latino, 32% of American Indian, Alaska Native, and 32% of Native Hawaiian and Pacific Islander potential voters said they sometimes or never vote, compared to 18% of white potential voters. In local elections, these numbers again are even higher. 62% of Asian and 61% of Latino adults reported they sometimes or never vote, compared to 42% of white potential voters. Asian and Latino adults were more likely than other groups to say they sometimes or never vote, but there was considerable variation within these groups. Among Latino ethnic groups, the proportion who rarely vote in presidential elections, shown with the blue bars in this slide, ranged from 15% among Puerto Rican adults to 46% of other Central American adults, which includes Costa Ricans, Hondurans, Nicaraguans, Panamanians, and Belizeans. In local elections, shown with the orange bars, more than 3/4 of other Central American adults recorded rarely voting, compared to just over half of South American and Guatemalan adults. Among Asian ethnic groups, thank you. Infrequent voting in local elections, shown with the orange bars, was highest among Chinese adults with 70% and lowest among Filipino adults with 53%, saying they sometimes or never vote in local elections. In presidential elections, shown with the blue bars, the proportion who rarely vote ranged from about 1/4 of Filipino and Japanese adults to half of Southeast Asian adults. Even though voter participation rates in national elections are not ideal, comparing the gap between the percentage voting in local elections and the percentage voting in presidential elections underscores how much higher voter participation sometimes is. Among Latino ethnic groups, the smallest gap between local and national elections was among Salvadoran adults, with a gap of 22 percentage points, and the largest difference was among Puerto Rican adults, with a very large gap of 57 percentage points. Among Asian ethnic groups, Japanese adults had the largest discrepancy between local and national elections, with a gap of 32 percentage points, whereas Southeast Asians had a gap of only 9 percentage points between those unlikely to vote in local and presidential elections. What are some of the reasons for not voting given by these infrequent voters? Well, the main reason for voting differed between presidential and local elections. Among potential voters who rarely vote in presidential elections, the most commonly provided reason was that they don't like politics or they don't like the candidates. The most common reason provided by those who rarely vote in local elections was that they are not informed enough about the candidates or the issues to make a good decision. Since we're in the midst of a presidential election, I'd also like to highlight some of the main reasons for not voting given by those who said they never vote in presidential elections or only vote sometimes in these elections. 28% of these potential but infrequent voters said it was because they don't like politics or don't like the candidates. 16% said they forgot or just didn't think about it. 15% reported feeling that they're not informed enough about the candidates or issues to make a good decision. 13% felt voting doesn't matter, saying that voting has little to do with decisions or that their vote would not affect things. And 7% said they had to work. At this point, I'll turn things back over to Todd so he can tell you about how you can access Chiz data.
Great, thank you, Sue. So here at the California Health Interview Survey, it has always been our priority to protect protect the confidentiality of the respondents who provide the responses to the survey, and create the foundation of the data that we are able to share. That said, it's also been our key objective to democratize access to the data, to make sure that as many possible users with as many different skill sets and different technological abilities can digest, explore, and analyze the results of the data and turn it into actionable policy. So we have multiple tools that are available for us to do that. The two tools identified in purple at the top of this chart are identified for some of our more powerful data users. A public use file is available for free download. It's currently available on our Chiz website, where you can look at record level data that's been anonymized and protected for confidentiality, but do your own analysis using that file. If you need more powerful access to the data, then we encourage you to work through our Data Access Center, which is a secure network that protects confidentiality further, but can allow us to run additional analyses for you. The three tools in orange here on the slide are publicly available and easily accessible, and provide a variety of different resources for you to query the data directly in Ask Chiz or Ask Chiz Neighborhood Edition. And the health profiles are static dashboards or PDF files that show highlights of the data. And throughout all of this, our health data program here at the Center for Health Policy Research can provide capacity building through special training and webinars. So I'd like to highlight some of the differences between the Ask Chiz platform as well as the Ask Chiz Neighborhood Edition system. These two tools work hand in hand to share the results of Chiz data. The Ask Chiz system was released with updated 2019 Chiz data this morning, and it provides estimates at the state level and at the county level, and it really enables you to generate custom queries, to cross certain indicators by others, to limit the population by age, by gender, by ethnicity, by various other demographics, and really customize your exploration of the data. If you'd like to have data at lower levels of geography, including assembly, senate, and congressional districts, cities, zip codes, and now even census tracts, then you should use the Ask Chiz Neighborhood Edition. This platform is currently in the process of being updated through 2018 data, and we expect that to be released in early 2021. This is a screenshot from the Ask Chiz Neighborhood Edition platform. It shows the map-based interface that allows you to explore the data to small to low levels of geography, as well as several different data visualization components that you can see here, which really enables you to compare different geographies, this graph showing, or this image showing state and county and zip codes, all being compared concurrently for the indicators of interest. I'd also like to encourage you, if you're less familiar with how to use our data access tools, to go to the website listed here, chiz.ucla.edu/Chiz training, to explore our on-demand learning center. It provides some brief and digestible videos that are short and simple and directed to really help people with no experience using our tools to be able to understand how to do simple queries and more powerful statistical analyses as well. I would also like to take a minute here today to highlight the fact that in the light of our COVID-19 pandemic that we're experiencing, although today's webinar has been focused on the 2019 survey results for Chiz, 2019 data from Chiz have already started to be released in a monthly preliminary format on some dashboards that are available. So if you go to the Center for Health Policy, so healthpolicy.ucla.edu, and then on the right-hand side, near the top, you click on Health Profiles and then go down and select COVID-19 Dashboards. You'll see options to explore some data connected to the COVID-19 pandemic, including 2020 Chiz COVID-19 preliminary monthly estimates, which includes new questions that we added to the survey in 2020 regarding the impacts of the pandemic. Two different tools connected to COVID-19 rates and risk factors by California County, both a dashboard and a data table. and then a Native Hawaiian Pacific Islander COVID-19 Data Policy Lab dashboard as well to explore the impacts on that community. We'd also like to inform you that we are preparing for some free Chiz data user training webinars that'll be coming soon. These webinars will allow you to be able to get some hands-on training for how to conduct searches in Ask Chiz, in Ask Chiz Neighborhood Edition, as well as these COVID-19 data dashboards. We have not yet finalized or announced specific dates for those, but if you connect to us to be on our mailing list at healthpolicy@ucla.edu, we'll be sure to keep you informed of those, and then you will be able to register directly through that forum. So as we wrap up our presentation, I would love to encourage you to dive into the data directly. Please visit us at www.chiz.ucla.edu. And I'd like to acknowledge our data collection partner, SSRS, our content partner, PHI, the members of our advisory boards and committees, and the very talented and dedicated crew on our UCLA Chiz team, whose names appear here on the slide. And at that point, we will transition to questions. Tiffany?
Thanks so much, Todd. Good afternoon, everyone. My name is Tiffany Lopes, and I'm the Director of Communications here at the UCLA Center for Health Policy Research. We're going to be going through questions from the audience today. If you haven't already, I encourage you to use the Q&A function in Zoom to ask questions. We're really excited about this data release, and we've got a lot of great questions from the audience. So let's begin with the first question. How does the new sampling affect trying to use multiple years of the Chiz?
Thank you, and I'm happy to answer that question. So as Nina's explained, it was a multi-year process that led to our redesign. We're very happy that thanks to some funding that we received from Kaiser as well as from the State Department of Healthcare Services to have conducted 2 different field experiments in 2018 that were conducted in parallel with Chiz production data collection that year. What that allowed us to do was to capture some concurrent estimates using the old methods and the new methods. And what we found as we reviewed some key indicators under the old and the new methods concurrently was that for the most part, indicators were in line with the previous estimates and that our users should feel comfortable in trending across years. There are some specific instances where, due to changes in presentation of the question by the web mode on the online versus the telephone mode that we've been using previously, where we do have some cautions for our data users. On our methodology page, there's a link to a full report and some appendices that really help to dive into the details of those specific instances. And we encourage you to educate yourself about the impact of those changes. However, let me restate again, broadly, we feel that users really can, with some comfort, trend across years in this redesign.
Thank you. We have another question about the redesign. So this was your first year doing the new mixed mode data collection technique rather than solely relying on phone calls. How did that go? Was it easier to reach required sample size? Did data collection go faster? And will you change anything in how you collect data going forward?
That's a great question. I'm also happy to answer that one. So the redesign really helped us solve a number of key problems that we were experiencing and really, address challenges as they evolved. So for example, the use of telephone to conduct surveys has been more and more challenging as years have passed. And what we found is that this redesign method did allow us to, number one, encourage a lot of households that were selected for the survey to respond online. Over 90% of our respondents in 2019 did choose the online option to respond. Doing that is less expensive and more efficient and can be done more quickly than a wholesale telephone-only mode of data collection. So that was one of the key benefits. Another of the key benefits we found was our ability to encourage households, busy families with children and with teenagers were more comfortable in responding through the web than answering a phone call under the old design. So that's how we were able to really increase the number of teen interviews and child interviews about children that helped us to accomplish those key goals of the program as well. So overall, we found it to be very successful. It was more efficient, it was more timely, and it helped us accomplish our mission. We are continually working to adapt, enhance, and improve the design of the survey. And so in 2020 and 2021, we continue to look for ways to improve data collection for speakers of other languages. We continue to look at ways of adapting our mail materials to try to encourage respondents to open those letters and respond to the survey. And it certainly enabled us in 2020 to continue data collection throughout this pandemic period. Despite changes in people working from home, we actually found greater success in 2020 for getting response to the survey than we did even in these 2019 results that we've shared. Thank you.
Great, thanks. Now we're going to talk about the voter participation fact sheet. How does the voting behaviors vary, or how do the voting behaviors vary by age, especially among Asian groups who are the least likely to vote?
Yeah, that is a good question. In general, voting rates are much lower among younger adults than they are among older adults. And as age goes up, the rates of voting go up. Although we did look at voting rates by race ethnicity, we did not in this study look at voting rates by both age and race. So I don't know the answer to the question of whether the combination of the two might change those relationships.
Got it.
Although we can look into that.
Right, can I just add, but you can look into that. Because I do want to look at, they can look into that.
And while we're talking about that, can you talk about findings among Black voters? You mostly spoke of Asian/Latinx.
Sure. In this study, we were interested in disaggregating, and we have limited ability in Chiz currently to disaggregate the Black African American population. However, we do see in terms of voting rates for that population that in presidential elections, the African American voters are somewhat less likely to vote than white voters, although they don't have the lowest rates. The lowest rates were among Asian and Latino voters. And then in local elections, actually the Black and African American potential voters in California told us that they were as likely to vote in local elections as the white voters.
Great, thank you.
And we do have these data broken or shown for all of the racial and ethnic groups in the fact sheet, which is available on our website.
Thanks, Sue. And I posted that in the chat for everyone.
But also, since we collect on foreign-born versus US-born, we could also probe and look at, for Black African-American voters, those who are naturalized citizens versus US-born citizens.
Thanks. Pertaining to the pandemic, what findings does the Chiz have on people's willingness to obtain a COVID-19 vaccine? And are there any notable differences by demographic subgroups?
Thank you. So that's a great reminder of the dashboard that we described that is available currently with several of our COVID impacts in the 2020 Chiz. Again, let me remind you that those estimates are monthly preliminary estimates. And so right now we have posted on the website some of the results from both May and June 2020. We'll be releasing in the next couple of weeks the July data as well. And as I look at that dashboard right now, we do have a specific indicator about people's willingness to obtain the COVID-19 vaccine. And as I look at it by race, there are individual race groups that have different rates of willingness to receive the vaccine. For example, Blacks were identified as 40% not being willing to receive a vaccine when it's available. Also, NHPI was quite high at 38.3%, and Latinos at 28.2%. So those were the three race groups that had the highest rates of stating that they would not be willing to get a vaccine if available as of June when we collected these data. So we also can allow our data users to look at those same characteristics or that same willingness by age, sex, region in the state, educational attainment, household size, income, insurance status, a number of other factors. And we encourage you really to dive into those dashboards to explore those data.
Thanks, Todd. You mentioned the Native Hawaiian Pacific Islander community. Has the Chiz considered oversampling the NHPI populations, given that California has the second largest population of NHPIs?
I'll start and then have Todd talk more about a special effort we're doing this year on the Native Hawaiian Pacific Islander population. So yes, we have considered it. We've actually, even before what Todd will convey to you, we've been thinking a lot about it, just because you'd have to pull several years, 5 years, 6 years of data to get stable insights. But we do have something that is in progress right now. So Todd.
Sure. So right now we're partnering with the California Tobacco Control Program to really collect some detailed information about smoking patterns and smoking cessation activities among the NHPI population. We're also doing a parallel study for the LGBTQ population as well. And so we're using some customized sampling techniques and different efforts to really try to get our target of 800 NHPI interviews across the state of California for that project.
Thank you. Does Chiz plan to disaggregate data about transgender, gender non-conforming, and non-binary gender identities in the future?
Yes, it's important that we make that data available. Given that it is a very small population size, it does require aggregating sample across multiple years of Chiz. We have already released some publications from Chiz data about health issues for the transgender or gender non-conforming population. I believe that was using 17-18 Chiz data. So I believe it was 2017 when we first implemented our current gender identity sequence of questions that allow us to identify the transgender population. So with each year of Chiz that passes, we can aggregate more and more responses together, which will enable more powerful analysis for that population.
Thanks. So we have a comment and a question. Great to hear the inclusion of voting patterns in Chiz. Can you discuss some of the ways this data can be analyzed with other health-related topics included in Chiz? In other words, how can voting data inform issues such as access barriers, health status, etc.?
Thank you. This is a great question, and it's actually one of the main motivations for including these voting questions in Chiz. We actually conducted some analyses using the 2017 and 2018 Chiz data and produced a policy brief, which was released in September, that focused on links between voting and health in California. We did find that healthier people were more likely to vote, and people with better access to healthcare were also more likely to vote. If you are interested in reading more, I would encourage you to check out that fact sheet or that policy brief.
Thanks, Sue. We have a question about gun ownership. Will we be including gun ownership questions anytime soon?
I'm very pleased to say that yes, we will be. We were funded, we were recently funded by NCGVR, and some questions on gun ownership will be fielded starting in 2021.
Thank you. Are Chiz respondents representative of the ethnicity and income at the same or similar representation in the state?
Well, all surveys or many population household surveys like Chiz acknowledge the fact that we won't necessarily get a perfect match in who we interview across the state with the proportions of those people at the population at large. And so we use different tools such as weighting of individual responses to known controls. So in this case, we do weight the raw response data to known controls for certain key population characteristics to ensure that the overall estimates that we produce, such as the data that we shared today, are representative of the distribution of the population across the state. So specifically, yes, by race and ethnicity, we do control for that in our weighting approach. And that's probably as technical as I'll want to get for today's webinar.
Thanks, Todd. That sounds great. How do you collect the data with adolescents since they're minor?
Yeah, that's a great question too. So we start by, in the original adult interview, we ask the parent of the teen for their consent to contact the teen to conduct the interview. When the parent gives their permission, we then send a mailing to the household. The letter to the household is addressed to the parent again, with a cover letter describing what it is that we'll be asking the teen to do. We describe the topics on the survey. We emphasize that, if there are certain topics they're uncomfortable answering, that they don't have to answer every question, for example. And then included in that mailing is a separate set of instructions for the teen to either go online and conduct the survey online, or to use a toll-free number to call and complete the survey by telephone. So it's certainly done with the parent's permission and with the assent of the teen as well.
Thanks. So we have kind of a big picture question. Were there any pieces you found particularly interesting or surprising in the 2019 Chiz?
That is a good question. Particularly surprising or interesting. I think, well, first of all, we highlighted those items today that were new topics that we found especially interesting. So any of these items, especially those for which we developed infographics today, we found especially interesting. Ninez, is there anything else you'd like to add?
Well, previously we highlight health insurance coverage. I think for those of you who are repeat viewers or are regular viewers, and the trends we were seeing were very similar to what we reported last year, in terms of the coverage rate being stable in California, which is different from what we see in some of the other states. And again, the story seems to be that there is a combination of, in 2019, some, the economic health, good economic health of California. So employer-sponsored insurance was increased a bit, and but Medicaid the Medi-Cal program went down a bit, and possibly offsetting the employer-sponsored insurance. So I think that was what we were looking at closely, but we believe that that's, first looked at it as, is this a real trend or not? Could it possibly be because of what one of the participants asked about in terms of maybe compositional changes that occurred because of the redesign? Like, are we getting higher income folks? Are we getting folks that have employer-sponsored insurance? So we did look at those very carefully. And then, of course, there's some caveats, but apart from that, I think I'm not a big surprise for us. I'm just trying to think if there's any other big surprises, because that's what I was monitoring, was what was happening with coverage. Sue, did you see anything in looking through your, because you also did some other policy briefs too. But not recently with the 2019 data, except for the voter.
Yeah.
Yeah, except for the voter engagement.
Right.
One.
Not with the 2019 data.
Okay. Thank you. Is this the first year you collected voting patterns in Chiz? And do you know if Asian and Latino populations voted more in the past, given that voting rates overall have gone down?
So 2019 is not the first year we've asked about voting in Chiz. The first year was 2017. But in terms of voting rates for specifically Asian and Latinos over time, I don't think we have really a long enough time period to answer that question yet. And yeah, at least not with our Chiz question. I mean, we do see lower rates among Latinos and Asians than the other racial and ethnic groups. But in terms of how that looks over time, there weren't huge differences between the 2017, 18, and 19 in terms of voting participation rates, self-reported voting participation rates.
Thanks. We have time for a few more questions. If anybody wants to get in last minute questions, please use the Q&A function. So how did you ensure low rates of online item non-response given the length of the survey?
I can tackle that. So yeah, certainly questionnaire length is something you have to be very mindful of, especially in an online survey, given that at any point a respondent could simply decide that they've had enough and click the little X in the corner of the box and leave the survey. Some of the ways that we've tried to do that, first of all, as we showed in one of the slides at the start of the presentation, 2019 was the first year that we changed the sequence of the questionnaire, in that we asked questions about the adult after we asked that adult questions about their child. So that was one key strategy that we employed in 2019. Number one, people are often more willing to talk about their children. The child questionnaire is shorter than the adult questionnaire. So they got through that short child questionnaire, they were engaged and interested, and then they kept going right through the adult questionnaire as well. So that was one positive change that enabled this in the web. That said, if a respondent did break off before reaching a point in the survey at which we considered it a sufficient completed interview, they were still eligible for the phase 2 of data collection, which was the outbound telephone calls. So we would then call some of those households back and encourage them to complete the survey by telephone.
Thank you. In the context of Chiz and the census, who are the important personnel that the public goes to understand the results in the state of California and the federal government?
Well, as far as understanding the context of the California results for the 2020 census, I would certainly encourage you to be in touch with the talented staff of the U.S. Census Bureau at the Los Angeles Regional Office, which is actually located in Van Nuys, I believe. So definitely reach out to those 2020 staff there. They have a dedicated team of people who help data users understand how to access the census data. And they also are generally quite talented at understanding other survey data that's available as a resource as well.
Thank you. Does Ask Chiz online query allow data users to look at the intersectionality of participants' identities across these domains, meaning medical conditions, access to healthcare, mental health, et cetera?
I can answer that. And I believe there's already been some beginnings of an answer. I'm also tracking the Q&A and the comments. And also thank you to the Chiz staff who have been very diligent in trying to answer all the questions here. So Ask Chiz, you are able to look at multiple domains. So you could look at, say, voting patterns by age as what was asked, by race, ethnicity. You could, there are some features in Ask Chiz where you can limit populations, and then you can also pull the data. So it is possible, or say you wanted to look at just the Southern California region or the Los Angeles County area, you're also able to subset that. So there is flexibility. It's not going to be as flexible as a downloaded free public use file for where you, and with a statistical program like SAS or Stata, that you could then look at these multiple dimensions and also interrogate a question using a multivariable regression framework. But that's definitely available free to the public as well.
Thank you. We have a couple minutes left. Any parting thoughts for the audience from the presenters?
Parting thoughts. Well, thank you for joining us. And I just want to say thank you to the Chiz team again. As I said, in 2020, data collection continued, and the activities to process this data so that we had an on-time delivery before Halloween, which we've done before, was possible with all the wonderful staff at Chiz, as well as the Center for Health Policy Research, in ensuring that we had operational excellence in working remotely. So I thank you for joining us. And the 2020, I think, just to underscore, we had never released data the same year before. We've never done that. It usually takes 9-10 months for us to release a full year annual estimates. So it was something that we thought we had to do very quickly. It was that we had to do a COVID-19 module very quickly. And it's I think, an indicator of how much we at the Center for Health Policy Research really listen to what stakeholders want, and then really just try to make it so.
Thank you. I just wanted to let the audience know, if you do have questions, please email us at healthpolicy@ucla.edu and we will get back to you. Again, just thank you to everyone for attending the California Health Interview Survey data release, and thank you to Nines Ponce, Todd Hughes, and Sue Badby for presenting these timely findings, as well as the entire Chiz team for helping to answer the questions throughout. We will be posting the recording of this webinar online with closed captions within the next 2 weeks. Please visit healthpolicy.ucla.edu. As a reminder, if you'd like a copy of today's presentation, please email us at healthpolicy@ucla.edu. Thank you and have a wonderful